Hey, I'm Dr. Soren, and I'm here with Dr. Scott Porter, a pharmacist in Sandpoint for many, many years. And tell me a little bit about your educational background as we get started.
I have a bachelor's degree in pharmacy, doctorate degree in pharmacology, and then with functional medicine, I've studied it over the last 15 years. I have family with autoimmune disease. I got intrigued on looking at the underlying cause, which led me to pursue different avenues versus Western medicine. So it's lots of coursework over the years, and I just grown to like that avenue. So it's something where I can do Western medicine and functional medicine. I've been doing it now for 15 plus years.
I love it. So yeah, you've been a pharmacist for a while. Did your dad start this
My dad
pharmacy?
started this business in 1973.
Wow.
I moved back home in 1999. So I've been practicing pharmacy for about 25 years.
Wow, that's awesome. Well, I love what you're doing because I think one of the issues I see with Western medicine, as I've said, has like the best technology if you get sick.
Correct.
Got the best drugs, the best equipment, and all over the world. But what I love about the functional medicine side is I think, as you got these fruit bowls here, diet, lifestyle, those things can play a huge role in preventing disease. So
Absolutely.
That's what I'm super excited about because, they talk about 80% of people, everybody's, concerned about this COVID virus, and 80% of the people that get it don't need any interventions, whereas that 20% need the hospitalization. So that's what I want to talk to you about is how can you boost your immune system, because that's really what makes the difference between that 80 and that 20% is the immune system.
Correct.
So if you're older and you have, immunocompromised, multiple diseases, then you're going to be more likely to get in that 20%. So,
Yep.
So let's start talking about what are your recommendations for avoiding viral infections?
So we mostly focus in on here on our nutrition center, starting out with foundational support. So I have a list of like 6 products that everyone should be on for immune support, foundational support. It always starts with a probiotic. This is a probiotic. It's got 4 products in one, probably our most popular. So we start with that, along with vitamin D with K. So these 2 are probably our mainstay products that we use for immune support. They say immunity is like 60% derived from your gut. Mm-hmm. So we always start with the gut.
And if I can just make a couple comments on these. Some of these conferences I've been to talk so much. This is like a revolution in medicine. We've discovered how powerful the gut is, and I think people underestimate that. So what does this do specifically?
This is probiotics aren't necessarily going to change your gut. I mean, you have like 300 trillion gut bacteria. What they send is signals. They send signals to the bacteria to start replicating, because there's competition going on, and that competition, you have die-off, and then you have inflammation, which causes leaky gut, which causes autoimmune disease, which causes disease. So the probiotics help send signals to produce beneficial gut bacteria to help with some of this competition, get rid of the bad bugs that are in there. It could be as well as yeast as well.
Okay, so that's that one. And then vitamin D. I think everybody we're in Sandpoint, Idaho, so everybody that lives this far north, I think, needs to be on a vitamin D supplement, because you just can't get enough from your skin the way you're supposed to in the wintertime, especially.
Yeah, not only that, vitamin D is also antibacterial and antiviral, and most of us are lacking it. So it's like, to me, this is essential, and it's also good for gut health. So we always start with probiotic first, vitamin D second.
Okay.
Third product we do is magnesium. 60% of the Western world is magnesium deficient. So this is here there's 10 different forms of magnesium. I have magnesium glycinate, works more in the tissues, less on the gut. So people with constipation, I would recommend magnesium citrate. This one right here has penetration into the brain and into the tissues. It's good for, all chemical reactions, cramping, whatnot. So we always choose magnesium as our third product.
And it's, for those who know, it's a natural muscle relaxant. I'm an anesthesiologist, and you use magnesium if somebody's having contraction. If a woman's in labor, you use magnesium to slow it down. And I know it works because when my wife started having early contractions, we put her on magnesium and it just stopped it. It was amazing.
Yep. So then moving right along, our fourth product is a good multivitamin. This one here is got extra B's in there. Most people have methylation problems, which is their body's ability to detoxify. So this is, we always choose a good multivitamin with methylated B vitamins, have a little extra calcium in there. Most people aren't getting that from their diet. So just a good around multivitamin is fourth on our list.
Do you have vitamin B somewhere on there? Somewhere else, or the B's are coming from
The B's are in here. If we were to figure out that someone did have methylation problems, then we would add in just extra methylated B vitamins, because you're going to have to take like milligram dosages of that, and you're not going to get that in a standard multivitamin.
Because that's one I take for my family, because we're vegan for the most part, and so it's really easy to get low on B12.
Exactly.
Because the way you're supposed to get B12 is you from bacteria in on your food. So if you pull a carrot out of the ground and eat it, it's got a little bacteria. But since our food is so cleaned and radiated, that even your vegetables don't have that anymore. So I'm a big fan of the B, especially B12.
Well, the B12, most of the B12s that are in multivitamins is cyanocobalamin. If you have methylation problems, you cannot convert the cyanocobalamin. So therefore, we recommend methylcobalamin or hydroxycobalamin.
I've heard that.
Adenocobalamin.
Yeah,
it's highly absorbable. In fact, we routinely give that as injections as hydroxycobalamin, not cyanocobalamin.
That's a good tip, and I know the one we have is hydroxy cobalamin.
Highly absorbable. All right, so the fifth product on our list is omegas. Why do we choose omegas? Our diet is so loaded in omega-6s that's pro-inflammatory.
And the omega-3 is anti-inflammatory.
Exactly.
So you gotta balance those.
So that's why we're doing this. We balance out the omega-3s with the omega-6s. Most people don't know what fish oils do. I mean, it's an anti-inflammatory product. It doesn't do anything to lower cholesterol, blood pressure, but it does work as an anti-inflammatory. That's why we recommend it.
Absolutely, and I think part of all this goes to our Western diet, because when you eat a lot of sugar, when your body metabolizes sugar, it pulls a lot of other nutrients out, so that's how you deplete it. If you eat a fruit, it's got all the nutrients there with it, but when we just take the sugar out of the fruit and just eat sugar, then your body's using up all these nutrients in order to handle our processed sugar that most of us probably eat too much of. So and same with our the omega-3s and 6s. I know a lot of even super healthy people that end up eating a lot of processed food that's high in omega-6s have inflammatory problems, and people forget that heart disease is an inflammatory disease.
Yes. Yep.
So if you can have inflammation inside your blood vessels, so if you can knock that inflammation down, you reduce your risk of a heart attack.
So we recommend the triglyceride form. It's most fish oils are ethyl ester. It's inferior absorption. You get a triglyceride form. It takes 2 extra processing steps, costs extra money, but it's 70% more absorbable than the ethyl ester form.
And just out of curiosity, do you have a non-animal based formula of omega-3?
Yes, we do. We do. It's the algae form, and then we have the flax. So we have algae and flax.
That is so cool, because I put flaxseed in my smoothie every morning, so that's
awesome.
my source.
Okay. Last product on our list of essential nutrients is digestive enzymes. Most people, including the elderly, they have low stomach pH. This low stomach pH leads to malabsorption. With malabsorption, you have inflammation. You're at higher risk of contracting viruses, bacterial infections. So digestive enzymes, they help break down food. It's also another anti-inflammatory product. So we typically use one that has got will put acid in the stomach as well as break down emulsified fats, protein, carbs, plant-derived products. So highly beneficial.
That is super cool. All right, so this is kind of your core, and
This is foundational.
from a lot of what you
This
said,
is foundational.
since I do pain management, a lot of this has to do with decreasing inflammation.
Yes.
And so this obviously would help people with arthritis type of pain or any sort of inflammatory problems. I mean, there's so many, even autoimmune diseases that create inflammation in joints. So
So keep this in mind when you're looking for a tool belt or even a toolbox. I recently remodeled the hardware department and doubled the inventory. Thanks.